Well, good morning to the folks that are joining us. I see a lot of familiar faces, but for those that are joining us from afar, thank you very much. We're going to go ahead and get started. So we're going to introduce an AI application today, but I want to take a moment and focus on what makes some of the AI applications that we're seeing very specific and very unique. And one of the things that's important to think about is that it's actually not the model development or the trustworthiness that are really the biggest challenges. It's how do you integrate these solutions into the workflow? How do you make them scalable? How are they agile? And how do you think about the idea of sort of accuracy? And so whether it's an AI application like you're going to hear from my colleague Rhett with Telemedicine, or it's something that somebody has yet to build, one of the things that we know is that you need to be able to design these solutions quick. You need the ability to rapidly innovate and change. They need to be scalable, and they have to integrate into the clinical workflow. And to do that, a lot of what needs to be considered is how you're going to orchestrate both people and systems and other systems. What we did in this particular use case that you're about to hear, and really the problem that we solved, is if you think about a wound, particularly if it's a diabetic ulcer, if it's a pressure ulcer, what makes wounds unique? Well, there's a lot of metadata. There's a lot of information about the wound itself. There's a lot of information about the patient. And so how do you build a system from end to end that allows you to de-identify the image, allows wound technicians to come into a platform and to annotate the wound, to incorporate other forms or features, to build a model? Every time new data comes in and the annotation occurs, that model is continuously updated. How do you do so in a way that it's federated? So as you deploy across hospitals and health systems and skilled nursing facilities, you ensure that the data stays where it belongs. You ensure that privacy, but every individual user is benefiting every time that new transaction occurs. Every time that model is updated, it's doing so in a federated fashion. How do you scale this in a way that you aren't forcing people to use a particular phone or device or Terraform, that they can really use anything that they want? How do you integrate this into the EMR? When you start thinking about all of those things that are necessary for the solution to reach scale, and by scale I mean that individuals are using it, they're using it continuously, it's starting to make a difference in the lives of patients. Hospitals and health systems are seeing improved accuracy in diagnostic. They're seeing the ability to understand that, hey, look, you actually had 10% of stage 2 ulcers that were diagnosed as stage 1. That becomes scale. So how do you do that? That's effectively what we did. It's idea is that what we partnered on, the platform that we provide, enables folks like Rhett and his company in combination with NTT Data to create these full end-to-end life cycles. Additionally, it gives us a lot of tolerance to what will happen in the future. We know that these models are going to get better. We know that the way that we train the model today, that new techniques will come out. And we have to be able to rapidly adapt and evolve the system and the application, not only to meet the needs of the user, but to continuously absorb the new technologies that will come. So whether it's incorporating clinical decision support into the tool so that you can understand that this is a stage 1 ulcer and a diabetic with uncontrolled diabetes and something different must happen versus this is a stage 1 ulcer, an individual who had a total knee and just is immobile. The system has the ability to evolve in that dynamic way, and you'll hear about the actual application that's coming to market in a second. And so what we think about in sort of this new paradigm as we enter in this age of AI is, what are the 3 things that these applications must incorporate? What is new types of platforms that enable you to develop these applications? What must they look like? And the first is that they're going to have to integrate the old and the new. There's a lot of existing CapEx that hospitals and health systems have spent on existing technology. And you're going to have to integrate that. There is no way to get around it. But they're also adopting a lot of other new technology. I can remember the first time I was on clinical service, I didn't see a lot of iPads or phones being used at the bedside, but that's pretty standard to how we practice today. So there's a lot of new devices that are even coming in. And so how do those get incorporated into the way that what you'll hear, these types of applications are designed? You have to be able to rapidly develop and deploy these. A lot of the CIOs and the CIOs that I work with are talking about speed to value, particularly with AI. They need to get these solutions out into clinical production, tested rapidly, and they need the ability themselves to make changes without having to incur a lot of costs, without having to find other services to make these changes. So we're talking about changes to the application and workflow in hours, not days. And that's kind of what they're expecting. And then you really have to be able to orchestrate. And that's the thing I talk about a lot, is that as a provider, what thing we understand is that you cannot automate healthcare. There's a lot of administrative things you can automate, but when it comes to clinical care delivery, it is about orchestration. Healthcare is hundreds of thousands of intricate workflows stacked upon each other, all very complex. And you orchestrate, and you must be able to orchestrate teams and systems and other technologies and processes and policies all in real time. And so that capability becomes really important, and this is the type of infrastructure that folks are going to need. So with that, I'm very excited to hand it over to Rhett to introduce the application that we are collectively bringing to market. I think it's one that will make a huge difference in the lives of patients, and you'll start to get a better sense of how we thought about solving for all these problems, not just trying to build an AI app and bring it to market.
Thanks, Ryan. So I love wounds. So it's not the wound itself that I love, but I love that wound progression is so visible, and I love that care providers can actually improve wound management over time. The more you do something, the more you repeat something, the better you perform. But the basis for good care with respect to wound care is first principles, good documentation. By documentation, I mean, what is the diagnosis? Today, around the world, 100% of the time, it's humans who are doing the diagnosis of the wound. As Ryan mentioned, a few different wound types. The most common that we see amongst our customers, and Wound Rounds is the app that has been in the market since actually 2007. And it's predominantly post-acute providers. So skilled nursing facilities, long-term acute care hospitals. We're getting into home health, as well as rehab hospitals. But there are a lot of wounds. Roughly 25% of the residents in these facilities have some kind of wound. The most common being pressure wounds, pressure ulcers, as well as diabetic ulcers and other chronic wounds related to their comorbidities, as well as, and this, whoever's had a relative or maybe they themselves have had a hip or knee replacement, that post-surgical incision is a wound, and 3.7% of the time that wound gets infected. So, and that's very problematic. So, I love that our customers, who are these care teams in these facilities, have on average with ultralight tech, which fits seamlessly within the workflow, within their own workflow, have been able to, on balance, improve the quality measures that they report to CMS by 50%. So we've done Legion case studies and analysis, and they're able to improve things if they're able to unite around a common set of data and achieve great things. So that's really the love I have for wound care. But here, I'll just backtrack. I did want to grab the one phrase in the quote at the bottom. What I also see is a tremendous amount of distress in these providers. The distress, workforce turnover, just retention issues, challenges with reimbursement. Okay, these are very under-resourced care settings, and so when I see a phrase called resources stretched thin, that's an understatement. This will be really easy and quick. We'll talk about the problem, the solution, and the methodology to build the thing. How did we partner to build this? And then our demo. So wound care is a big deal. I would love you all to check me on this, but by my best estimates, wound care and complications cost the U.S. total healthcare system, in terms of our total healthcare spend, between 3 and 5%. So at plus $4 trillion, that is a monster number. A monster number. Also, tons of liability, just related to lawsuits, regulatory fines and tags, and non-payment by the likes of CMS, right? These are all preventable tragedies, and again, from where I sit, a good chunk of that cost can be pulled out through the likes of AI solutions that we're about to deliver to market. Just to grab one thing out of here, just the challenge of chronic wounds. I just had a call with our largest Canadian-based customer this morning, and I do a survey because we're positioning pilots for go-to-market this quarter. So I asked them what proportion of the wound assessments within their facilities have errors, fundamental errors, staging errors, classification errors, wound type errors, calling a moisture-associated skin breakdown by a patient with incontinence, calling that a pressure ulcer. By and large, it's 20% of the time. 20% of the time. And of course, this is variable from care setting to care settings. You say, oh, no way would a hospital system have errors, an error rate that high? But how do they know? Where's the oversight? Well, we're going to give them a really easy way to provide decision support and QA around that. So this is the integrated solution. So with our partners, Vantic, we're a small company at Telemedicine Solutions. Wound Rounds is our flagship application. We have 15 people. We've done a really good job with our market segment. We've built 10 million assessments, a database of 10 million assessments, each 100% complete, which also is a unicorn in healthcare. But we had no AI expertise and no AI go-to-market expertise. So we partnered with Vantic and also NTT Data, which I know from past lives in their delivery of multiple AI applications to multiple industries. We wanted to go to market quickly because we just thought that this was the thing that our customers needed most. I'm sorry for the warning, for not providing the warning, but these are some of the wounds. I'm going to flash through it to the next slide. But I'm sorry, I've probably seen hundreds of thousands of wound images because in this AI training process, the humans need to QA some of the images just to make doubly sure there's no patient health information, like names on paper rulers or someone's face in an image. So we go through actually a triple or a double-blind process where we have humans scrub the images before we pass it on to the wound engine at Vantic. And then we have wound trainers, which use Vantic's platform, which you can see, check what the documentation was of the assessment and make corrections, as well as contextualize the wound. Where is the wound versus everything else in the image? And given that Wound Rounds is an iOS form factor based app, there are pictures of literally everything in this data set. So contextualization is key. So what we're talking about in terms of this use case, it's where is the wound in the picture? And so what I can validate and verify is that Vantic has built a tool that actually auto-identifies the wound from everything else, the signal from the noise. So what we're delivering to market this quarter with our own customers, our Wound Rounds customers, is a pilot version of Wound AI, validated for pressure injuries, which are, again, the biggest hotspot of risk and liability for these providers. But it will be validated for roughly 90% of the pressure wounds they see. And the flow of this is going to be for the pilot version, and we'll have a GA version, general availability version in Q1. But for the pilot version, they'll be able to log into a portal to make the selections. And by the way, anyone looking to see a live demo, we didn't want to risk the tech risks or the demo risks and a speaking engagement. But if you want to see a live demo, it's scrolling over the Vantique booth, a Strone's throw that way. So, but the users at the bedside have the ability to log in to Wound AI, make their selections, generate, and what Wound AI shows, or what it shows, is the AI's judgment call, their insights on each assessment. So do they confirm, and what is the confidence score, or do they deconfirm? And what we're doing is really suggesting that the user reassess and consult a colleague. So it gives a collaboration tool for both the facility-based care team, as well as offsite, if they have a corporate wound nurse, for instance, to collaborate. And we believe that kind of the dark horse in terms of ROIs in this will be, it's a phenomenal tool for education as well, and to really accelerate training for their wound nurses that are not as well trained on wound staging and classification. Scalability, I really want to hit on that. If you Google wound care devices, etc., you could find half a dozen actual form factors, devices that require a specific form factor with its own algorithms or sensors. We didn't want to get into the woods of only building something that could be used on one form factor, either a piece of hardware with a certain number of sensors. The requirements for Wound AI at GA, which again, today I can say I would like it to be Q1, so are pretty simple. One, the provider in whatever care setting takes a picture, an image of a wound, a digital image of a wound, and does a wound assessment, so fills in wound parameters. And those can be fed through APIs in real time, and not interrupting the workflow after the assessment is saved, they will see the AI insight and be able to either correct the assessment or start a new one, or just exit out and move on to the next assessment. So we do not want to interrupt the workflow at all, and I'm really excited about what we're building together.
Thanks, Rhett. So as we kind of wrap up, just a few things to really take away. The entire application that is coming to market in planning for the GA was built in a matter of weeks. Not to be facetious, but literally a matter of weeks. And anyone in healthcare knows that context is everything. So when you saw the annotation tool, what you're not seeing is just, this is a stage 1 ulcer. You're seeing, this is a stage 1 ulcer of a left heel with these other parameters. So the data that's being contextualized is feeding the model. The ability for anyone to use any device in any care setting and quickly, in the process of analyzing and documenting a wound, to get a real-time feedback image is very, very important. And additionally, the idea that this is also built on a federated architecture means that as this gets to scale, we will have federated learning. Hospitals and health systems that adopt the solution do not need to be worried about the images or the data leaving the EMR, leaving their enclave, but resting assured that every other hospital that's using this and all the work that's going on at scale is actually continuously making this model better. It's what will separate it from any other model on the market, is that this will have the power of scale. And so instead of having to continuously retrain the model is trained every single time a new assessment is done. So it's learning in real time. It's learning at a level of scale that makes it quite unique from other solutions. And then the other thing is that it's future-proof. The current way that the neural net or the model is trained is likely going to evolve. How do you rapidly make a change and push that out to every user? We have that future-proof built into this. So those are the things that we really needed to think about, and the things that people need to think about as they're building AI applications and solutions. The model development will come, and it's getting faster and it's getting cheaper. But how do you get to scale? How do you integrate into the workflow? What are the things that users are going to want and they're going to need? And how do you offer that from the very onset? That's a big part of what we thought about. That's a big part of the requirements that we weren't willing to negotiate on, and why I think we're so excited about how fast this will come to market, how fast it will become the best application out there, and the difference it will make in the lives of patients and providers. I think that's it. Perfect timing.
Great.
We planned that exactly right? So
Thanks
for joining.
everyone.
Thanks for sticking around.
Thank you.